So what an SLP does is help people with communication disorders. They can actually work with any ages dependent upon what area they choose to focus on. Some work in the school systems, working with anything ranging from teaching autistic children alternative communication to those students with hearing loss and learning how to function within and without the classroom. They teach them to effectively converse with their peers. They will help children learn to overcome speech problems, and oftentimes those students can graduate from the program through their hard work. They will work in medical settings, rehabbing those with traumatic brain injuries, diagnosing other communication or swallowing problems, and they work usually in tandem with other medical professionals on that patient's team. Oftentimes, they are key figures when recovering from strokes, head injuries, or even respiratory system issues. When working in these settings, communication isn't the only area of concern. They will help patients overcome eating and swallowing, or as we call it in the biz, dysphagia issues. SLPs work with those going through gender realignment to identify a natural cadence of their voice. This can actually help them identify their new persona and become more comfortable with who they are. Other areas include corporate settings. Interestingly, they can help people reduce accents or even become more articulate, among many, many other things. Pathologists can also help counsel not only their own patients, but the patients' families as well, as there's typically a little bit of discord within the family when there's a communication disorder. Communication, however, does not always mean speech. While it does include verbal speech, it doesn't necessarily have to. SLPs essentially work to make conversation accessible to everyone. Many people, myself included, prior to studying the work of SLPs, don't necessarily realize that SLPs work to help those who have trouble in terms of social communication. This can include greeting, asking questions, reading the room, or rather figuring out appropriate communication for different settings. Speech language pathologists will even teach people to follow the standard convention for conversation. People don't realize the huge amount of work it takes to be an SLP. In order to practice, you have to have a master's degree that includes 400 hours of clinicals, plus you have to take a test. It's pretty much an amazing career.